Welcome to Crystal Medical Life. Today we are going to discuss about the most trending topic in medical field, which is AI in medicine. If you are a medical student or doctor, this question might cross your brain. Will AI replace me? Will AI take over doctors in the future? Will hospital become doctorless because of AI? Will AI replace you as a doctor? So answer is no, never. So I will explain you how AI works and how can you train the AI machine and how it reply to your questions query and how it differentiate thing from one to another. First, you have to purchase large language models like ChatGPT, Gemini or Grok. It should be a naive AI because you are going to teach that AI machine. So it should be a naive AI, and you will put this photograph into the AI machine. These round things are the these things are the fruits. So AI will understand that okay, this is fruits, this is fruit, this is fruit, this is fruit, and you will ask simple question, how many fruits in this image? It will probably say 7. So now you are thinking that why 7? This is the not fruit. So this considered as a fruit in AI machine because you didn't teach this thing that this peel is different from fruit. Now you can explain this same thing to the model by enforcement. This is not fruit, this is our peel of apple. It will not consider this peel as a fruit for next time. So now you can ask the question, same question, and now it will reply like 3 apple, 1, 2, 3, and so now it will tell that 6 fruits are there. Now you can ask different question, how many apples and how many kiwis in this image? It is not trained to differentiate the fruits. It will hallucinate and say that 6 apple or 6 kiwi or 6 anything else. It is not knowing anything, so might be just telling you that 6. So you have to explain this AI machine that this thing is apple. You can see the convex thing this side and concavity this sides. So this is considered as apple, red color, and this brown color fruit is a kiwi. You have to explain like this to the AI. So next time you will ask question, how many apple and how many kiwis in this image? It will probably answer 3 apples and 3 kiwis. Nice. Now upload this image to your trained model and ask same question, how many apples and how many kiwis in this image? It will probably say 3 apple, 3 kiwi, because it cannot differentiate these things. Tomato is look like apple, so it will consider tomato as apple because you taught only apple. This is mistake AI can make. This is called hallucination. Now you have to tell difference between tomato and apple. So it will consider that okay, this one is apple, this one is tomato, this one is chiku, this one is kiwi. So there are 2000 plus fruits in this world. You have to explain about everything to the AI model, then it will able to distinguish different type of fruits, and it is impossible to explain everything. Why? I can explain you. It's not just easy that just give that image of apple and it's over. No, it's not over. You have to upload the 360-degree view of your apple from front side, back side, lateral sides, and you have to rotate from all sides, and also you have to cut that apple and show the internal surface of apple. Otherwise it will not recognize if it is open. Understand? You have to show everything about that apple in multiple images. Now your model learned about one variant of apple. Congratulations. but not enough. There are 29,999 variant you have to teach. You are saying that there are 30,000 variant of apple? Yes. I am not saying from my side. You can see the sources, you can search Google, ChatGPT, everything you can do and see. There are so many variants, and if someone come with some odd type of lady apple or liberty apple, then Macon apple, Macintosh apple, then Melrose apple, what will you do? How can your machine will know the difference between the polar red apple and red delicious apple? You have to train that model. Now we are coming to our main topic, medicine. So if you are medical student, then you can see this image and tell the name of this cell. This is red blood cell. Okay, red blood cell everyone know, but pathologist is knowing the more than 50 types of RBCs, 50 variants of RBC, by size, by shape, by color, by inclusion. This is about just one cell, which is a red blood cell without nuclei. Understand? I am knowing this thing, but my professor with the 20 year of experience, he know many other form of the rare RBCs, and you are telling that, oh, AI will learn it. Then congratulations again, you just taught RBC. But there are 4,000 type of cells in entire body, different type of. There are 50 trillion cells, but 4,000 varieties, 600 types of muscle, 400 types of nerve with the 12 cranial nerves, artery, 600 types of arteries, 1,000 type of vein, 206 bone, more than 5,000 diagnostic tests, 20,000 medication, and thousands of treatment modalities, 10,000 plus disease, 2,000 plus symptoms, 1,000 plus sign, and there are so many grades, scoring system, so much. There are 50 to 60,000 modalities or terms in medicine with, I am not talking about the subspecialty in it. There are so many things in this one thing. If you are taking the muscle, you can do so much study. There are so many books on just a single muscle fiber, changes in the single muscle fiber. It is impossible. Why? I am telling you that they do not have time. Who? Doctors. So we do not have time. It is a true thing. Doctors are overburdened and they have so much of work. And if you are asking about my professors, they don't have 1 minute to talk. They have so many projects, so many thesis work, so many patients to manage, and how can they provide days and weeks and months to these AI machines? Not possible. If you are giving money to just doing this stuff, then you have to acquire thousands plus highly qualified with the 20 plus year experience. That type of doctors you need from every continent or subcontinent. So it will a $1 billion project, and you have to make these doctors sit under the one roof, which is very impossible, because American doctor will not listen to European doctor and European doctor will not listen to your American doctor. This is fact. There is so much guideline according to the continent, and this is impossible to make one guideline for entire world. It is impossible. Now you can gather all doctors and have so many money in your pocket. Still there is a main hurdle, is the patient data. I will not allow any third party to intervene or to look at my patient data, because my patient is my love and I will not expose privacy of my love. Fourth problem is cloud storage issue. You need some cloud storage facility to upload these images, videos and actions and graphs. Everything you have to enter into the computer and you have to upload on the cloud storage, because that is so much of data you required. Some slide scanning, histopathology or hematopathology slides, they are scanned at the 1000 magnifications, and that data will acquired 5 GB per slide. So it requires 6 terabyte per day to gather every information from one institute. I am not telling about the entire country. One day this cloud storage will be hacked. Someone who is dangerous and who can blackmail to entire government. And fifth possibility is if patient dies by mistake, who will be liable? A owner of AI model or doctors who train that model? Obviously doctors, because billionaires never go to the jail. So my point is that doctors will not help these companies to get profit. They are very good at their own. They will teach medical students who are doing very hard work to get admission into medical school, and this is very important thing to know. So what AI will replace in medical field? Not you, probably not you, but it will replace long prescription writing, which is helpful. You can just enter the disease. It will make a prescription based on the age, weight of the patient. You can modify it later. Then monotonous practice in diagnostic branch is like according to mitosis, then nuclear pleomorphism and pattern of the tumor, patterns of that tumor, you can make grading. So that will be abolished, and AI will make that grade easily. It will be great assistant to every doctor. It can help you to make email, it can make your paragraph articles and everything. Physical books will not be used anymore. There are digital books and you can upload on AI and get the answer from that AI. Theory classrooms will abolish, because AI is very good at teaching. It can teach you things like concepts, abstract. It is best. And study apps in market, you are paying so much money to the some applications. I will not take names, but they will be abolished, because the MCQ formation is very good by AI machines. And the PPT making, you don't worry about the seminar lectures. There are some AI softwares which make PPT within 1 minute. I have example, and here you can see this image I took from the internet, which is available on internet, and this is the ileal biopsy showing the CMV inclusions in endothelial cells. It is clearly seeing, you can see these arrows, and the crypts are very good and round, not distorted, but yes, cryptitis is there. And I asked same question to all three large language models. Here you can see the response from ChatGPT, no mention of CMV at all. Grok and Gemini, this is a funny thing, because their teachers taught like this, ki if you are seeing the histopathology slide, just utter the word granuloma, and here there is no component of granuloma in this image, and you can see that these models are answering like well-formed granuloma. Where is the well-formed granuloma? You are making the granulomatous inflammation in this slide. It make miserable diagnosis. You cannot rely on this. And see the diagnostic panels. They ordered millions of tests for just one simple diagnosis. How can you rely on this AI? These are 10 years of teaching. 10 years of teaching. So please don't trust AI for diagnosis. AI is very naive, and people are not training these models that nano levels. Okay, so it will not get better after 5, 10 years or 20 years. Thank you for watching this video, and subscribe my YouTube channel. I will upload how can you be the best doctor with help of AI. This is my next video, and please subscribe and turn on the notification. Thank you.